I think, the current landscape of misinformation is widespread and scary at times as a physician. In the ER, for example, I will get a lot of patients that maybe are taking a certain supplement or certain thing they found online, or even as something as simple as something they got over the counter. And it's because they, heard about it on social media, or they heard about it from someone that sent them a certain article. And the thing is that they didn't have a discussion. So a lot of folks may have like 4 or 5 different medical conditions. They may be on blood thinners and certain medications that can interact with each other. And then adding a supplement or a medication or something into that mix could potentially be harmful and lead to, things like internal bleeding or kidney failure, or whatever the case may be. And so I think the fact that, we think we care a lot about our health, which we do, but then the bar of acting on our health and potentially adding something harmful to it has, in my opinion, kind of been lowered with, um, maybe since post pandemic, in my experience. And that's made it really, I think, something that we need to pay attention to as physicians, because I think traditionally we were like, okay, we could ignore what's going on, online, maybe like in 2010, 2012, and most of it's not going to impact us. But that couldn't be further from the truth in 2024, when a lot of the things that the patients are doing end up in our ERs, in our clinics. And so I think that is kind of the thing that to me sticks out. I think the role of social media is kind of magnifying this misinformation. And so we have always had misinformation and confusing information since humans have existed, right? We've had the snake oil salesmen of the 20s and 30s. We had the fad diets and the magic pills that came about when the internet came about in the late 90s, early 2000s. We've always had, your grandma saying, hey, you can have the soup and cure your pneumonia. Is it really? No. But is it going to cause harm? No. And so we've kind of had these kinds of things. What has changed is what social media has done to them. And kind of looking at things, I think it's a few different things. One, social media, when you see something, a lot of times misinformation is going to be novel. It's going to be new. It's going to be something you haven't seen before. And so that kind of incites emotions in us, right? Maybe some of it might be excitement and you want to share it with a family member because they're dealing with a certain issue, or something like that. And so there's that combined with a lack of deliberation. So, traditionally, if you saw something on the television sitting around with friends or family, or you read a newspaper, you had time to discuss it with those around you and have it marinate a little before you shared it or sent it to someone. Now that's not a thing. And so you get this novel piece of information and you get excited by it, and that deliberation is not there. It's simply a copy, paste, sent to your group chat or email chain. And then that is led with confirmation bias. And so eventually that is circulated around and you see a version of it come back to you, and you maybe see it on a certain social media platform. And so now you've seen this kind of what you think is fact a few times, and you're like, okay, it's got to be real. And so I think those things combined make things that are based in misinformation much more prevalent, and they spread much quicker, and there's less of a deliberative process to put a stop to those things. And by the time you know it, a lot of times these things have done the harm that they are going to cause, unfortunately, by the time the media or the medical community picks up about it and starts to put out warnings and actual fact-based guidances. And I think that's where the role of the physician comes. We need to be aware of things that are trending in our communities before they turn into community-wide, statewide, national emergencies. And so if there's a certain trend, us being able to voice that to our hospital systems, to our local authorities, to whatever the case may be. The other thing is that I think a lot of physicians shy away from social media because they think like, hey, I'm a physician, I've earned this really professional degree, I need to remain professional, and social media isn't seen as professional at times. But I don't think that's the truth these days, right? We have the World Health Organization, the CDC, the White House, all these organizations that play a big part in our health that are on these platforms. And the Surgeon General actually last year released a report on misinformation, that one of the kind of prescriptions, if you will, for physicians was engaging in these spaces. And so I think that's what our role is here. that we establish ourselves in these spaces, whether it's you as an individual or your clinic or your hospital system, and put out fact-based information, but that when these things do start trending in the wrong direction, whether it's another pandemic or whether it's the new version of the Tide Pod challenge, we're able to get ahead of it and put that information out there rather than starting from zero and figuring out how we're going to deal with social media. So those are, I think, kind of the main things that are on my radar. I guess the final thing I would say, if I had to add anything, is that when someone goes on social media in a professional setting, I think there's this preconceived notion that you have to be an expert at all things and you need to know all the answers. And that's not the truth. What you need to be an expert at is what you're good at, right? So maybe you're really good at, you had like a computer science background, and then you went into medicine, and you can really tell which AI tools that people are marketing to healthcare professionals are actually useful and which are trash, for a lack of a better word, and sharing stuff about that. Maybe you did a lot of mission work in Africa and you're really familiar with mosquito-borne illnesses, and West Nile is now affecting your community. That's what you talk about. And so you don't have to talk about every issue and all issues, but finding things that you are very comfortable with speaking about and talking about those. And then, of course, you're never giving formal medical advice over social media. It's more just kind of public, broad stroke guidances, and then directing people to resources and websites that actually can help them if you can't.